Don Thomas won the Nobel Prize in 1990 for the development of bone marrow transplantation. People that are familiar with bone marrow transplants know that the majority of cases are used to cure patients who have diseases of the bone marrow, such as leukemia, lymphoma, sickle cell anemia. One thing that is less obvious is that when you do a bone marrow transplant, you're not just substituting a new bone marrow that makes red cells and platelets, but also you're putting in the donor's immune system and replacing the patient's own immune system with that donor's immune system. That means that marrow transplantation also has the possibility of curing almost every immune-based disease that a patient might have. Some of the first transplants that were ever done were for patients who were children that had something called severe combined immune deficiency. These are kids that are born with a very, very defective immune system and generally die before they're 1 year old. But now, marrow transplantation is used to treat these kids. In fact, these children in the United States are screened at birth because transplantation works so well if you do it before they ever have an infection. And so throughout the United States, when you do that little heel stick and you get that little drop of blood, one of the things they're screening for are immune deficiencies. And if that's found, we can now cure more than 95% of kids of these immune deficiencies. Fortunately, that's a fairly rare event. Much more common are other autoimmune diseases, such as Scleroderma or Crohn's disease or lupus. Now, early on, we found that there were a number of patients who had leukemia who also had Crohn's disease. And when we did the transplant for leukemia, not only did we cure their leukemia, but their Crohn's disease went away. Now, we don't normally use transplantation to treat most autoimmune diseases because there's other therapies that can work, and the risks of transplantation are probably too great. But there are other autoimmune diseases which are really devastating, like Scleroderma, where the life expectancy is shorter than with leukemia, or severe multiple sclerosis. And here we found that marrow transplantation offers a way to cure those patients. And as transplantation becomes safer and safer, I think what we'll find is that it will be applied more often in these immune-based diseases. Now, there's one other manifestation of the fact that you're transplanting a donor's bone marrow into a patient. And this is something that Don Thomas thought about when he first entered the arena of marrow transplantation. He saw a patient by the name of Richard Herrick, who was the first person ever to be cured with a kidney transplant. Now, the reason he was able to be cured is that he had an identical twin, and Joe Murray, who was in Boston at the time, did that transplant. And when Don did this first marrow transplant, he realized that if you could do a marrow transplant, you would be putting the new immune system from the donor into the patient. If you then took a kidney from that donor, the patient would be tolerant to that kidney because it's the same immune system as the kidney. Currently, we are finding that if you do kidney transplants, they do work, but they only work for normally less than a decade, and patients have to be on lifelong immune suppression. What if you did a bone marrow transplant first and then did a kidney transplant? The patient should be tolerant to the kidney and be able to be taken off of all immune suppression. And in fact, this is now being done. There are studies that have shown that if you do what's called a small or mini bone marrow transplant first, you can follow with a kidney transplant, and the patients can be taken off of all immune suppression and are tolerant for that kidney for the rest of their lives. Well, if you can do that for kidneys, will we be able to do that for liver? Will we be able to do that for heart? It could change the entire landscape for doing solid organ transplants. Currently, there are far fewer organs available than there are patients who need them. And that's because the organs have to be replaced time and again and are often rejected. Marrow transplantation in the future might offer a surprising other way of doing solid organ transplants that could change the lives of just tens of thousands of patients.